It's health this Tuesday morning, and our topic today, health screening, a panacea to healthy living. Dr. Awojumobi, or Tokiti Oluwakemi, is our guest today, a passionate and dedicated consultant in hematology and lab science. It is great to have you. You're welcome. I love your dress, by the way.
Thank you.
You could as well be an work of art, as well as a doctor. So, okay, so we're talking about health screening today, you know, and I know we started this discussion on, we've been talking about it up until now and all of that. But yes, maybe once again for a recap, what have we covered so far and where are we going to today?
So in the previous discussion that we had, we spoke basically on what health screening is, and health screening is a means or strategy to identify diseases or risk factors in individuals before the disease becomes clinically obvious or apparent. And there's just one simple goal: identify early, treat early, give a better chance at cure, give a better chance at management, give a better chance before complications start to arise. So at the end of the day, the person is better off.
Wonderful. So our focus today, what's our focus for today's discussion?
So I think for this discussion, I would like to just elucidate different type of screening methods available and different diseases that screening tests are available that can help identify before they become.
Okay, so let's go. Let's kick off. Let's talk about the methods and kind of tests you could take.
Right. So as I said earlier on before, the goal of screening is that you want to first mitigate complications from happening. You can even prevent the development of the disease entirely, thereby reducing the incidence of disease in the first place. So quite a number of diseases, very important diseases, clinically important diseases to individuals and to the population are available, like the pap smear. So the pap smear helps to identify women that are at risk of developing cervical cancer. And then we have the mammogram that can detect subclinical nodes in the breast before clinically obvious breast cancer happens. And then there are pre-diabetes screening. So before an individual develops diabetes, you can pick it up, and something as simple as a weight loss regimen or lifestyle modification can prevent the development of diabetes entirely. Entirely? Yes, and you're talking about AFB, colonoscopy for colon cancer, colorectal cancer, screening for inborn errors of metabolism before the complications start happening and all that. So there are quite a number of array of screening tests available.
Now, I want to ask this. Now, this is something that so many people don't know. Susceptibility to a particular kind of disease, maybe from family history and all of that. You know, how important is it for a person to know your family history, maybe the kind of sicknesses that your father, your grandfather, your uncles, so that you can understand maybe your susceptibility ratio or factor, as the case may be, and, you know, prevent it? How important is it for one to know the family medical history in all of this?
Very important. There's something they tell us in medical school many years back that aside from environmental factors influencing the risk factor of developing a disease or disorder, genetic makeup is just as important. Yes. So virtually for any kind of disease, we always ask, do you have any family history of this kind of disorder in a first degree relative, like your mother, your father, your sister, is very important. So individuals who have previous family history of certain disease will advise them, okay, go for screening earlier. Don't wait for the recommended time. Maybe when you're an adult, start screening. If you start feeling these symptoms, start screening. So very important. And it's also important to know that in certain institutions, health institutions like where I work, Fitness Healthcare, we have different packages that have been tailored to tailored to different individuals. So you can help, like, you can determine that for an individual, a male or a female is at this age, definitely there are some tests that can be done to screen them for certain diseases that they are susceptible to.
Okay, all right. So we'll just take a very short break. Stay with us. We will be right back with this one. Welcome back. Sorry about that slight technical issue. It's been sorted and we're back. Now we're talking about screening, health screening, panacea to healthy living. And Doctor, you were at the point where you were talking about the different packages that you have that cater to different people with different needs. Can you please go over that again?
Okay, so thank you very much. At Fit Plus Healthcare, we have different screening packages and health packages that have been tailored to different sets of individuals. So whether you're a child, you're a kid, you're a young adult, you're an elderly person, male or female, different risk factors, family history, whatever it is, there are different screening packages available.
What if I don't have all this information? Yes, there's some people that don't know how old they are. You know that. You know that. There's some people that don't know how old they are. Of course, definitely for the generation just before us, the baby boomers and all of that. So people don't know their exact age. There's a lot of people who don't know their family history. And there's some people who are in families where now something happened and they are not really, their father is not really their father. Like, you understand? Yes. In those kind of scenarios where you don't have all this information, where next? How can one proceed with a screen test?
Okay, so that is very easy. The mere fact, at least it's obvious, you're either a male or female.
Okay.
You're either a young adult or an elderly person or a child. So whatever your health needs are, whatever category of life you fall in, there's always something for you. There is always a way to go about this thing and, find something tailored to your need. And also depending on the clinical symptoms or whatever you want. At Fit Plus Healthcare, we are able to, just because we have in-house consultants and that's, that can care for you and then just provide the services you need, whatever it may be. So that's not a problem.
Yes, the most important thing is get a professional and talk to somebody.
Yes.
And then from there,
there is always something.
Thank you so much, Doctor.
Thank you.
It was a pleasure having you on the show this morning, and I hope that with all that we're doing, people are more, they have the knowledge more to go out there and take care of screen
It's better to know, and like they say, prevention is better.
Thank you. Thank you so much. All right, that's it on health this morning. We'll take a time out now. Don't go nowhere. The show is still on.